Hello, I wish you a wonderful day, and I think the technical things are working. Hello to the Ukraine.
Hello, we can hear you and can see you. Hello.
Excellent. So I'll be back later.
Зоряна головата. Драгоміра. Ну, я ж кажу, я такого там. Субтитри до фільму «Офіційними». Чого? Це не офіційно. Я офіційно. А, ти що було? Антонио, сказать лишний нет. Это еще не окончание его.
Вітаю. Ви б не могли вимикати мікрофон, поки ви не є учасником заходу або дискусії, бо вас всі чують. Врахуйте, будь ласка. Good day, Excellencies, distinguished guests. Welcome to second international online conference, COVID-19 pandemic in the context of humanitarian crisis, East Ukrainian situation and international experience. The conference is organized by the Embassy of Sovereign Order of Malta to Ukraine with media and technical support by GDAP Media Center and Swiss Institute of Cultural Diplomacy as a media supporting partner. We would like to express our gratitude to all our guests who kindly join us today. We hope you will enjoy our event. Goals of today's meeting will be to update on the situation COVID-19 in Ukraine and especially in the east of Ukraine, highlights of the new criticism and needs that have been found in the evolution of COVID-19 pandemic, update on the vaccination program in Ukraine with particular reference to the eastern areas, the problem of the virus variants, the impact on the economy, the situation with hospitals facilities in the world, and in particular in Ukraine and in the east of Ukraine. Health education and vaccination programs for children, exchange of experience between national and international guests, and development of possible future strategies. In our in-meeting chat, you can find information about technical support, about translation settings. Also, you will find program there and list of participants. Also, you are welcome to ask any question in our in-meeting chat. Now, let me pass the word to the moderator of our session, Dr. Emmanuel Bruni, Health Cluster Coordinator from the WHO office in Ukraine. Mr. Bruni, please, the floor is yours.
Thank you very much. Can you hear me well?
Yes, we can hear you well, please.
Excellent. His Excellency's Ambassador, excellent colleagues, excellent partners, it is a real pleasure to be here again for this second international online conference on COVID-19 pandemic in the context of humanitarian crisis, the East Ukrainian situation and the international experience. I'm really pleased because I have a sort of double hatting here. On the one side, I represent, of course, the World Health Organization as well as my colleagues that will intervene in this important section. But on the other, and I think is the one I'm also honored of, I represent the 60 health cluster partners, which are operating in the east of Ukraine. Those are operating mainly in those two regions that are affected by conflict, and those affected are now really intensified by the presence of this pandemic since almost 2 years. I will not anticipate anything about data and situation because I think there are several presentations that go deep into that. What I feel as a coordinator is that there is a huge improvement in terms of our capacity to respond and our awareness and our capacity to understand a bit. But at the same time, still the situation is a bit concerning. Actually, it's quite concerning. And allow me to say, in the East, it's even more concerning than other parts of Ukraine. Maybe this is because we look much at the East with a different lens, and it's the lens also of the affected population by conflict. But it's even true that epidemiological data might show sometimes something also in that related, as well as the capacity to respond. Sometimes you might have good epidemiological data, but no capacity, or vice versa. And in this case, we have to say that both indicators are concerning. Say that I want to congratulate all the presenters to be here. And if you allow me, I would like to give the word to His Excellency Ambassador Antonio Gazzanti Pugliese di Cotrone. Good afternoon, Ambassador.
Thank you. Can you hear me?
Loud and clear, sir.
Okay, thank you. Dear friends, welcome to the second online conference, COVID-19 pandemic in the context of the humanitarian crisis, situation in Eastern Ukraine and international experience, organized by the Embassy of the Sovereign Order of Malta to Ukraine. I would like to thank everyone, and in particular the speakers, who will participate today and who will discuss a number of topics. Since the beginning of February 2021, the date of the first conference on COVID-19 organized by our embassy, the scenario has changed profoundly. Some answers have been found, but many questions have arisen. The vaccination campaign presents difficulties, which are not only related to the availability and the distribution of vaccines. These include, to give just a few examples, the objections to the administration of the vaccines themselves, the effects over time, the duration of vaccination coverage, and the questions of the third dose, the doubts about the vaccination of children, even the youngest, especially in the context of school imprisons. The obligation of vaccination and its contrast with some of the constitutional principles of most democratic states. Vaccination and the workplace, the international Green Pass, the difficult territorial realities of many parts of the world, and among them the east of Ukraine. All this is aggravated by information campaigns that often lack reliable references and are exploited by intentions that are anything but transparent. Another delicate aspect is the development of variants. There are many questions on this matter, such as, are and will vaccines and antiviral drugs be effective against virus variants? Can the new spread of the virus that is occurring in certain geographical areas produce some new and more lethal variants? Can the variants combine and have even more amplified effects? How much longer will we have to live with this virus that changes so rapidly over time? Even from these few hints, it is clear that mankind is facing a particularly complex problem. It is also clear that science alone cannot solve it. Just to think of the ethical, social, humanitarian, financial, economic, geopolitical, and other aspects of this problem. Everything becomes even more evident when set against the background of an already difficult situation, such as that of Eastern Ukraine. Here, the COVID-19 pandemic has exacerbated the living condition of so many IDPs, elderly people, children, homeless, people with economic difficulties who are already suffering from the long conflict. We must be aware that the battle against COVID-19 is far from over. We must continue to keep our guard up and call upon the best resources we have in the field. And above all, we must be guided by the principle of internal and international solidarity. In this context, one of the founding values of the Sovereign Order of Malta, Auxilium Pauperum, care and availability for the poorest and the most defenseless, is particularly topical nowadays. I am sure that this conference, given the authority of all the speakers, will make a significant contribution to the management of the discussed issues. I wish you all good work. Thank you. Thank you for your attention.
Many thanks, Ambassador, and many thanks for such a also comprehensive description of the situation. I think this really fits what's happening in those days. And we are a bit ahead with the schedule, but this could be actually something useful because maybe later we might be late, so maybe we'll compensate. So if everyone agrees, I would like to proceed already with the first presentation, which will be done by Mr. Aaron Aregai from the WHO mission to Ukraine. Mr. Aregai is the WHO, so World Health Organization Emergency Program Information Management and Risk Assessment Team Lead. And he will present about the epidemiological projection concerning COVID-19 in East Ukraine and public health situation analysis. But before that, I still want to thank again the Ambassador Antonio Gazzanti Pugliese di Cotrone, because of this presentation, and also for especially for remarking the Auxilium Pauperum, that I think is a very good it's a very good way to address the humanitarian response. And as a humanitarian, I think that's the real way to look at that. Aaron, are you online?
Yes.
Good afternoon. We hear you loud and clear. Would you like to share your presentation, sir?
Yes. Thank you, Your Excellency, Ambassador and colleagues for having us in this important meeting. I will try to share my screen. Emanuele, you let me know if you can see the screen.
We can see it. You can put the slides if you feel like, the slideshow.
Okay. Is it okay now?
Yes, now it's larger and everyone can see.
Excellent. Thank you. And I will try to keep my time. So I'll try to cover my topic with this following outline. A very brief on the public health situation analysis based on the information we have for the Eastern conflict area, focusing on GCA. Again, the SARS-CoV-2 situation with highlight more towards the two oblasts in the conflict affected area and modeling projection. Then I will conclude with my summary slide. I want to start with, based on the information we have in 2020, our team has compiled several information, basically to look into what are the major mortality causes in the Eastern conflict area. And as you can see, NCD takes the bigger role, the biggest share, and compared to the other parts of the country, we try to compare the rate, the normalized rate per 100,000 population. And you can see CVD, the cardiovascular disease, cancer and diabetes among the major NCDs, the three of them. And particularly you can see Donetsk and Lugansk GCA have higher rates per 100,000 population compared to the rest of the country. Again, we also see the same for TV, particularly in Lugansk, higher rates, as well as in Donetsk. There is overall, I think we can say the NCD as a cause of higher mortality rates. When we see, again, this is still work in progress, and there might be few changes here and there, but overall, our situation analysis indicates that in the coming 3 to 6 months and beyond, the COVID pandemic will still continue to have a major burden in the Eastern conflict area, as well as TB, HIV, and as I mentioned, NCDs plus vaccine preventable disease. As you all know, following the recent also incident of polio outbreak, we still see this as a potential danger. So going out of this, I will try to give you a couple of slides on COVID situation, starting from the global picture, and then go immediately to the area which we focus all of us here. So I think you can see here the pandemic continues to change with time. We have had major 3 waves and another 4th peak showing at the global level. I mean, American region and the European region taking the biggest share here. We see an increase in infection, but also there is an improvement in mortality rate thanks to the higher vaccination coverage. Ambassador was talking about the variant of concerns and variant continue to evolve. But so far what we know based on, this is the data based on the last 60 days sequencing reported to WHO, and predominantly Delta seems to overcompete other variants. So there are here and there Gamma, Beta and Alpha cases still popping up. but dominantly the Delta variant seems to outcompete the other variants and easily dominating at a global level, including in Ukraine. So now coming to the situation in Ukraine and zooming into the two oblasts, as you can see, as of 16th of November, 18 oblasts of Ukraine are under red zone, according to the indicators set out by Ministry of Health. Only 5 oblasts are in orange and 2 in yellow. And out of these 18, both Lugansk and Donetsk GCA are in the red zone. Again, implementation of the public health measures is on its own a lot of limitations, and colleagues who have been visiting those regions have had a number of observations, but I will not go into those details. Just to give us an impression of where we are heading from infection perspective and mortality. These last few weeks have been very difficult, as we all observed, and Donetsk GCA, you can see, has peak hospitalization, mortality, as well as infection rate. But there is a hope, or there's a sign of stabilization and to some extent a reduction in both mortality as well as infection. So when we see the peak has been on the last week of October, between 21 and 27 October. That's when we have recorded the highest number of infections. However, the last 7 days has been a slight reduction by 10% from the previous weeks. So there is a hope that we might have seen the peak of this pandemic wave, particularly, in Donetsk. The same picture in Lugansk as well. The peak was observed in the 3rd week of October, where we have 560 infections in 20 days in the same day. Whereas when we see reported infection between 10 to 16 November, we have seen a slight decline by 35%. According to the official reports. But I want to draw one thing here, that is officially reported infections are indication, but we have to also take these figures with some grain of salt. We cannot just start celebrating by seeing this early indication. So our message has been carefully continue to follow this. I will have 1-2 slides on more hospitalization, which is a very important indicator. And what we see here for both Donetsk and Lugansk is the hospitalization rate has been, particularly for Donetsk, very worrying. It reached a maximum of 91% of all hospital beds being occupied. But in the last 2 to 3 weeks, there is a tendency of more patients being discharged than admitted. So that is a good sign again. When you have more patients being discharged from hospitals compared to the new admissions, then that is a hope for improving the situation as well as the mortality. Again, Lugansk also, we saw the same. One thing that we need to follow again here is the authorities in the two regions keep on adding hospitals to their COVID designated network. What it means is you will have more beds as a denominator, then the percentage of occupancy starts to go down because there are more hospital beds added to the network. So when we interpret the information of occupancy rate at hospital, again, needs to be very careful with the amount of beds that are being allocated. I've already indicated this. Overall, as a country level, as well as for Donetsk and Lugansk, there's a sign of new admissions and new discharges. When we compare these two important indicators in hospital data, we see discharges are becoming more, picking up lately and higher than admission. Of course, Lugansk is not yet into that stage. Still, Lugansk shows higher admission than discharge, but Donetsk shows a significant increase in the last few weeks. So more patients are being discharged. Now I will go to my third section of my presentation, which I will highlight the projection. So we have seen what the situation looks like as of now. My projection then will cover between now until the end of the year. So what is the prospect of the epi situation in the two regions in the coming, I would say, 1 month and a half, roughly. First, a brief description of our model, how we project this epidemiology is we use this deterministic model that takes into consideration these different compartments. What are very important assumptions here is one, we take vaccination coverage into account. So as you all know, or as you might have followed recently, Ukraine is showing a very encouraging surge in vaccination rates. I would say we're very encouraged, and if we continue in this scale, we might reach the WHO target of 40% of adult population being fully vaccinated by the end of the year. So we have that hope with the latest vaccination rate. So we take that projection into account when we do this epidemiologic projection that by the end of December, this number of people will be vaccinated. But more important assumptions in our projection is hospitalization. And based on hospitalization, we project the infection. So we don't follow the infection, rather we follow hospitalization. And just to take you back, the assumption, I just want to highlight a few things here. One, we assume the Delta variant is the dominant strain that's circulating, as well as severe and mild share. 30% of all infections will be severe, whereas 70% of them will be mild. And finally, we take also the consideration of vaccine efficacy for Delta variant to be 80% as a fully vaccinated, and only 30% efficacy when cases are partially vaccinated, which is 1 dose. So the good sign here is both infection as well as hospitalization will gradually go down until the end of December 2021. But as you can see in my projection, I have the confidence interval. That confidence interval tells us if things do not carefully be managed, there is a tendency that the higher boundary or the higher bound of the confidence interval might hold true. So what it means is by the end of December, we might assume daily infection to be around 228, but this could go up to 628. The same thing for hospitalization. But what we know, based on the capacity of hospitals now in Donetsk, we don't expect an overflow of the capacity. So what it means is hospitalization is not expected to overflow the current capacity of hospital beds, which in this case we have 4,000 beds in Donetsk. And we don't expect to bypass or surpass this capacity by December. Again, the same thing for oxygen beds and ICU capacity. Particularly ICU has been a challenge. As you can see, late in October, we have reached into the limit, but our projection indicates that we might show a decline in both ICU need as well as oxygen. The trend is not very different as well for Lugansk. We expect a much lower infection rate in Lugansk, around 60 per day by the end of December, but it could range between 15 to 200. Whereas hospitalization at the end of December, we expect a cumulative hospitalization of around 150, but that could go up to a 470 and plus. And again, the capacity is not expected to be overflooded. It holds true for oxygen capacity as well as ICU capacity in Lugansk. All in all, the peak look like it's behind us, and we will continue to slowly go down into the minimum around indicated figures here. So the final one slide before my summary is on cumulative mortality. So by the end of our projection period in December, we expect around 5,400 total mortality to be in Donetsk, as well as 2,160 with the confidence interval of up to 2,300 in Lugansk. So with that, I will conclude with a summary slide. So a couple of points to highlight here is one on the public health situation I've highlighted. It shows COVID will continue to have an impact, not as a direct cause of mortality only, but also as indirect impact on other NCDs. The WHO model as well predicts a declining trend in infection and hospitalization rates. However, if the public health measures that are in place are immediately lifted, we might have either a plateau or a surge in both hospitalization. So our message here is that we need to be very careful in lifting this myth and careful review of these measures, as well as I mentioned in my earlier slide that it's important to maintain the recent gains in vaccination so that we reach the target of a minimum of 40% of adult population being vaccinated by the end of the year. With that, I thank you and give the floor back to Emanuele.
Thank you very much, dear Aaron. Congratulations on this presentation. I think it's very good for those who organized this conference to put this presentation as a first one, because of course it gives an overall, but also it's an extremely technical presentation with a lot of acronyms and so on. So normally I do the summary of the presentation, but this was done by Aaron. I just want to clarify NCD is the non-communicable diseases or so-called chronic disease for those that maybe are, so that just to clarify that these are the main killers in the east of Ukraine and affect a specific chunk of the population, which is normally the over 60 years old. So this is a very good point. And when Aaron talks about public health and social measures, he's talking about those measures that affect the life of everyone, also from border control to mask wearing to lockdowns or quarantines, isolation, and so forth. So he's not talking all about measures that are taken at health facilities, but is on the everyday life. This is why they are called social measures and not only public health one. And this is excellent also the remark of Aaron, saying that despite the situation might show some improvement, also because maybe vaccination might have some support into that, and the occupation of the ICU, so the intensive care units, is decreasing, and as projection, still is better to think about maintaining a high profile towards those measures, because the situation is not even good, even if it's declining, it's not even good. And so it's very good remark from our epidemiologist here. So thanks a lot, Aaron, again. I would like to give the floor for, I think we can have the floor for 2 or maximum 3 questions. And I let the participants ask directly to Aaron. Let me know if you need any mediation for that. Over for questions. Maybe a good idea would be to raise the hand with the Zoom tool, but if not, you can just connect your mic and just say, I have a question. I don't see any question at the moment, dear Aaron. Of course, your presentation was also very clear. So I assume that not many people might have anything to say about the data you showed and the concern you showed. Maybe something about the projection. And if there are no further questions, I would kindly ask to the next presenter, which is still another WHO emergency program expert to prepare. I'm talking about Dr. Israel Gestoso, who is the emergency medical services and clinical management specialist Israel is, of course, a medical doctor, and he leads everything that is related to the clinical management, not only of COVID-19, but definitely in the incident management structure is the pillar lead for that. His presentation will be about the designated COVID-19 hospitals in the east of Ukraine, what's their general situation, about clinical management, and mainly also the impact in human resources. Dr. Gestoso, Israel, are you able to connect with us? Over.
Yes, thank you very much, Emanuele. Can you
Good
hear me
afternoon.
properly?
I do. You are free to share your presentation.
Yes, I will do that. So here it is. Can you see it properly?
I can see that. Please, the floor is yours.
Okay, well, thank you very much, Emanuele. Thank you, everyone, for this opportunity to coming together and sharing all this knowledge. Thank you very much to Aaron. As you can see, Aaron has just shared the cornerstone of the situation in the country. And even though we are getting better figures, and I will not take that as a good, but better figures, we are still at a very high risk of the system to actually not being capable to responding to the needs of patients. And it all comes, as Emanuele says, because we need to follow strictly the measures that have been put on place and be as complacent as possible. So what we are going to talk about, and I will be very happy to answer to any of your questions, is what the situation is regarding the hospital and the access regarding COVID-19 in Ukraine, and we will specify about the East. As you know, when the pandemic was declared in Ukraine, more than 400 hospitals, this was 475 hospitals
Exactly.
were, yes.
I'm sorry to interrupt you. I just wondered if you are trying to scroll your diapositives, they are not moving at the moment.
I was not yet.
Okay, sorry. Just sorry to interrupt you. Just technical.
No.
Over.
Thank you very much. Thank you. So let me just give you just the big picture. I guess Aaron and you are all aware. At the very first moment, we had nearly 500 hospitals dedicated to COVID-19. When the numbers decreased, this was June 2021, we actually half-sized the number of hospitals dedicated to COVID-19. So we can see that the system actually responded. Was this the best option? We are not. It is not my intention to discuss about that, but I just want to let you know that Ukraine is such a large country, and it comes from such a system where the number of beds is always very high. We do have a lot of facilities and a lot of beds, but we do not have the rest of the items that we actually need to treat people, which are doctors, nurses, equipment, and especially oxygen, that I will talk about later on. So please be very mindful in your minds that numbers, when they adjust to beds, they do not reflect the pure reality. I can let you know that these past weeks, despite the general numbers, we do have hospitals that actually reach 100% of occupation several days a week at both the general ward, and I am talking about COVID, non-severe cases, and critically ill, meaning when someone gets sick and cannot actually, and actually needs a bed and oxygen supply, it is not that easy to get it. And this is something that we all should bear in mind. So there is a problem of utilization of the system, okay? And the scarcity of resources. So I will go on. This is just a number. These numbers change all the time, but just for your information, and we are talking about the East, this is the conflict affected zone. Just look at the total number of beds that this hospital have and the number of allocated beds to COVID. They are always insufficient. Okay, and let us remind that this is not only the number, but the capability that we have to give high flow oxygen to these patients, because the hospital have not been renovated for decades. So in order to get the actual good treatment, we may use, and we will see it later on, oxygen cylinders and any other types, the very well-known oxygen concentrators, which are not at several kind of patients the optimal way of treatment. In some other hospital, and you can see here Pokrovsk, we are actually giving all the beds to COVID because some hospitals cannot cope anymore with the number of patients. The meaning is we are displacing the rest of people that actually need healthcare, meaning we are not securing essential health services because we need to allocate all the resources to COVID. Look at Minorhat, look at Pokrovsk, look at Konstantinivka, okay? So we really are counting on hospital just dedicated to COVID. Think of other diseases that we cannot treat at this very moment, at this location. We are in Ukraine, such a big country where distances count, especially on emergency features. So let's recap. Who are we? Who do we need to give this proper care? In the conflict area, we are assisting to a humanitarian situation with the highest number of elderly, meaning the people with an age of over 60, they constitute the bulk of the needs. And this happens uniquely in Ukraine. This is the conflict, the humanitarian conflict, where the highest number of elderly. And of course, people with disabilities, because of the conflict, this is a conflict zone where people do suffer from shelling, and we do have a problem with disabilities. The children and youth, they constitute also a vulnerable group, women and girls, and we have also a problem with gender-based violence. And of course, here in Ukraine, we do have a problem with victims of human trafficking. Ukraine, it is also unfortunately the lead of mortality due to cardiovascular diseases in such a way that it affects the life expectancy out of the whole European region as first, meaning male within around an age of 60 will die of stroke because of the inability of the system to actually cope. Imagine the impact that COVID is having over this population that is already affected. And here you do have the numbers that have been directly affected because of the conflict. You may stop me if you have any questions. I will be happy to respond, but I will keep on. So what is our reality today in Ukraine? We are going through a reform, a health reform that actually is aiming to the oblast, to the regions, to be as autonomous and independent. Oh, sorry, someone unmuted.
Yes, I would like to ask to the colleagues to mute themselves, please.
Thank you, Emanuele. I shall go on. So we are going through a reform. Thank you, Emanuele. So we are going through a reform where the government wants to the oblast, to the regions, to be as independent and autonomous as they can, which is something that has happened all over several countries in Europe. But today we can say that we have not reached all the indicators that will actually make them as autonomous as desired. Even the Ministry of Health will develop and approve the standards and the critical protocols, but this formality has no impact in the quality of care because of the lack of suitable enforcement mechanisms. Meaning, if there is, imagine, a protocol on COVID, on oxygen therapy, it needs to come from Kyiv, from the Ministry of Health, but if not, it will be implemented in the oblast. We have a lack of enforcement of this mechanism. Also, we do have a problem with data recording. We don't really know what's happening because of how big the country is and how insufficient the data recording processes are. So we do proxy diagnosis and proxy recommendations. Of course, we have very, very close and accurate, especially from WHO, because we do physically our assessments. But we need to count on how large Ukrainian is and how non-optimal the data recording processes are. Just remember that many healthcare workers have left Ukraine because of the conflict or other reasons. So we do have a very big healthcare workers shortage. not only in the whole country, but especially in government-controlled areas. I am not discussing about non-government controlled areas here, but you can imagine that situation is same or worse. I may go on. So the access, this meaning people do not have enough money for the medicines because they have to pay for most of it, even though national mandate doesn't say so, but that is not the reality. Distance to healthcare facilities. Some people, they do get sick and cannot actually reach, and I am talking specifically, and this is something that Emanuele and the health cluster is taking care of because of a problem of access in the conflict area. The cost of travel remains the same thing. People cannot actually afford travel to healthcare facilities, especially the closest we are to the contact line. There is no public transportation, there are no optimal roads, and there is a restricted movement because of the military checkpoints as well. And as I am saying, the ambulances, they have a limited access to the settlements, especially next to the contact line. If someone falls sick, it is not that easy to get this medical attention. And of course, I am sure you are familiar with the situation at the checkpoints, which is very challenging, okay? Even though there are some organizations that do actually give medical care at that point, we are talking about walking distance, not capability of crossing of an ambulance, and 5 to 10 hours to get permission to cross when we face our -10, -15 degrees within 3 weeks in our winter in Ukraine. So what happened and how did the COVID-19, and we have grasped a little bit of the general situations, but let me talk, for example, about tuberculosis, which is endemic in Ukraine and unfortunately leads also the number of cases in the European region. The COVID-19 quarantine measures, they do put restriction on us in order to travel. So that gives us a reduced availability of all types of medical care for patients because you cannot actually move. And it is very difficult because of how the situation happens in the contact line to actually explain to the military, I really need to go and see a doctor because of my chronic disease. That won't be a reason that would actually allow us to cross. Imagine on tuberculosis, people do not have a proper access to microbiological and radiological diagnosis, meaning we cannot have our X-ray, we cannot get the diagnosis by the microbiologist in order to actually give a proper and proven diagnosis. Of course, we could not only get to diagnosis, but to treatment. You do know that tuberculosis is a direct observed treatment. We do need to go to a certain healthcare facility to get our medications so that we are keeping track of our treatment. That cannot happen because of the restriction of COVID and because of the specificities of the conflict. So we go into a delay on delivery of drugs and consumables as well, and a restriction on the distribution between the regions. So you can imagine, and I can let you know that this year, after 10 years of not increase, there has been the first increase of TB mortality in the world. And Ukraine must be on the spotlight and the watch out because of this situation. So what are the constraints of the system, as we were talking before? Excuse me. The availability of oxygen supply, which is not secure at all levels. Sorry, give me just 1 second. Give me 1 minute. I'm sorry, oh, let me go back. Oxygen output, concentrators, ventilators, they are not available throughout the whole system. There is a deficiency on infection prevention and control measures. We already discussed that human resources are lacking. And when I say they are lacking, it's not only because we have not filled up all the vacancies of doctors and nurses, but they do get sick because of COVID. Okay, so those days and that time, they cannot actually work and give the service. The continuity of essential health services and patient cares have been disrupted. Okay, most of the hospitals, sorry, the majority, they cannot assure logistics and human resources in order to give continuity of healthcare. Implementation of standard procedures is very uneven. Despite the big efforts that WHO and other organizations do, the guidance is not uniform throughout Ukraine. There is a low vaccination rate. As we all know, we are up to 30% in the general population. That leads to the situation that we have now. So we do need to stress up the needs of vaccination in Ukraine. And let us remind that the situation around the contact line is always much worse regarding access. If you want to get the vaccine, it won't be that easy in Donetsk than in Lviv, in Odessa, in Mykolaiv. Okay, so we really need to focus on these areas because of the limit of access. Okay. One last thing I would like to discuss down here is that the preparedness mechanisms are not up to par. So if there is an intensification of the conflict resulting in civilian casualties, as it has happened, or any other disease outbreak, we will not be ready because of how the situation happens over there. So also a major aspect on the spot. Let me go on. Emanuele, do I have more minutes or should I
just have 60 seconds?
Okay, so I'm not going through the rest. I just want to let you know that WHO is targeting all these aspects that we have discussed. Of course, let us think that us as an organization, we cannot take care of human resources and financing, but we do upgrade the standards and the equipment and coordination through Emanuele and his team. And just a few pictures on what we do, how we implement oxygen safety in hospitals, how we actually provide oxygen tanks according to needs, how many differences there are between oblasts because of the beautiful diversity and size of our country, Ukraine. And I guess this 60, look at the standards. Okay, you can see this is not what we need in the country, in any country. So this is what we work on. Okay, so this is on the left what is happening, this is on the right what it should be. That's what we are aiming with your help and your input and your finance. So thank you for that. And several steps. This is me without my biomedical engineer and the rest of the team during supply of tanks. And really, thank you very much, Emanuele, and thank you everyone for your attention. It is my pleasure. And if there are any questions, I'll be happy to respond.
Thanks a lot, Israel. And also, mainly also because we can see that there is a lot of passion in your work, and it's really what we need also sometimes is the motivation. One observation that I heard yesterday during a meeting from a colleague from a UN agency is that sometimes there is lack of flexibility among some health workers, and what we need sometimes is really more flexibility, because sometimes you need to have more extra work in bringing oxygen supply or in vaccinating people and adapting to the context. So you are exactly showing this spirit, and first of all, my thanks is on this regard. Then, of course, you did a resume. We are talking about human resources that are stretched. We are talking about oxygen supply that are really caring. We are in the sense that they are missing. We are talking about infection and prevention control, which is divided between protective equipment, but also the idea of doing a correct triage, which also is a clinical triage. So you are going through different levels, and definitely is also important to remind that the vaccination level is quite lower and the access in those areas. And when we talk about access, we're talking about humanitarian access, which means access to the people, but also people accessing the service, and finally a sort of geographical related access. All these situations, in case of need of contingency, are not completely strong. And so in case we have an increase of conflict, will put us in difficulty. So definitely very wide intervention. I would like to see if there is any question from the plateau, or if not, I will move to the next speaker. I give 1 minute for questions. I know that there is one little change, and that the Ministry of Health asked to actually intervene now. And if there is no question, I will give the floor, thanking again Israel and WHO for this.
Thank you, everyone. It's been my pleasure.
Thank you,
Thank you,
Israel.
Emanuele.
Our pleasure. So, if there is no question, I would like to give the floor to Dr. Igor Kuzin, whom I'm very glad to finally meet. It's really great to meet you, Doctor, and I hope we can meet again. And Dr. Kuzin is the Deputy Ministry of Health of Ukraine, and is the Chief State Sanitary Doctor of Ukraine. And he will give us an overall epidemiological situation of COVID-19 program in Ukraine, looking specifically at the east of Ukraine, with the analysis of Ministry of Health. Dr. Kuzin, do you hear us well? The floor is yours if you want to start. We see your presentation. Over.
Dear colleagues, good morning. I hope that you can hear us, and it's a pleasure to me to present the precise information on Ukraine. And I would just like to start from the fact that in reality, when we would look at the statistics on all over Ukraine, you can see that right now we are going through the third wave that has its own tempo or trends on the number of people who got sick. Is just really the highest from the beginning of the registration of case number 1. The first case we have registered on the 2nd of March of 2020. And from that time onward, we had registered 3.3 million cases and 2.7 cases of people who have finally recovered, and also 79,000 people who have deceased because of COVID-19. We are really observing the facts that right now 18 oblasts of Ukraine are actually in the red epidemic zone. And so each and every oblast that are entering this red epidemiological zone, like in 2 to 3 weeks, the indicators are starting to stabilize. And so the oblasts that have the highest of indicators for vaccination, they either like faster move out of the red zone, or they have the least level of burden to the healthcare system in the first place. If you would have a look on the age distribution, then in reality, what we have is that the most number of cases is from people who are the working age from 30 to 69 years of age, which is the people who have COVID. And so they are together as a 72% of all the cases. And if you would have a look on the mortality indicators, then what we see that the general world or global tendency and trends, the people who are over 60, they have much higher chance of dying from COVID-19, apart from people in like from 20 to 39, for example. Therefore, we have picked a strategy on the first initial vaccination of people 60 plus and the risk groups as well, and have support this initiative by trying to conduct it throughout all of the oblasts. And also right now it's effectively working. If we would have just a look at the new incidence or the incidence of new COVID-19 cases, then we can have a look and can see that the most targeted oblasts or the most affected or burdened oblasts that we have this week, those are the ones of the east of Ukraine and the south of Ukraine. And the epidemic is slowly just moving from this oblast to the center and to the west of Ukraine. And in reality, this kind of movement of this epidemic is for us the critical factor, because we start to understand that the first 2 waves, they were actually moving in the vice versa. They were moving from the west of Ukraine to the east of Ukraine. And therefore, the Western Oblast, they were initially have more developed infrastructure at the first place and more prepared people. And therefore, the kind of follow-up or course of the pandemic happens for us. It's critical for us just because that in the past few months, we had to really rapidly add up the capacity on almost like 30,000 beds, 30,000 hospital beds, so that in east and the south regions of Ukraine, they would have an ability to provide an adequate healthcare services. And in the first time throughout the history, the Kherson Oblast, for example, they have opened up a field hospital for COVID patients that has been coordinated by the National Emergency Service. And so this is also a situation when we are opening up, because we do have an understanding that the system there, healthcare system, could not sustain this kind of burden, or we have to say no to any kind of basic services in any kind of healthcare area. And I would also like to stop just to say a few words about mortality. The overall average mortality from COVID-19 right now is 2.4%. The average mortality rate is 206 per 100,000 population. But what we see is that in the oblast, that where there's the least number of people vaccinated, where there is the highest gathering of people, so that the density of the population on the 1 square kilometer is because of those indicators, the mortality rate actually grows rapidly well. And so what we are trying to do right now, which is to rapidly change the treatment protocols so that we would not allow for the mortality as for in the pre-hospital stage and for the hospital or inpatient stage. The other more systemic problems exist that are saying to us that the Institute of Family Doctors, for example, not in all the oblasts, they are fully acting so that on the primary care of the healthcare system, they would be like timely and rapid care provided. Therefore, I think that this area of development has to be one of the key to be supported. So regarding diagnostics is also a key element of how do we counteract the COVID, or how do we stay prepared. And so overall, we have conducted 15.5 million PCR tests. And in the summer period of time, we were able to do in such a way that each and every oblast, we have the fully functioning Center for Disease Control and Prevention that is able to do a big number of tests at the same time without a big of a delay. What we had is we have 4 hubs or the ones that are able to decrease the load for oblasts that are receiving a big number of samples all at once. And with the support of the WHO Country Office Ukraine, those educated specialists, they have SOPs, algorithms, timetables, or anything else that's needed. So even if the number of tests grows in a day, we are not noting any kind of the substantial delay in the results provision. Therefore, what we can see here is that right now we started to slowly decrease in the percentage of positive cases or positivity rate of tests, for example, which is a good sign, because we understand that in the most of oblasts, especially the ones that have been in the red zone, they are slowly moving for those peak outside of those peak burden. But we still have to be very careful when we will try to get from or to get them back to the regular type of functioning they had before, not to allow them to get any kind of worsening of the situation. As I mentioned before, the vaccination in Ukraine and the key intervention in the country that allows to decrease the complexity of the COVID-19 and to decrease the level of mortality from the COVID and mortality rate. And so as for today, we've made almost 22 million of jabs, and 12.6 million people got at least 1 dose already, and 9.3 million people got 2 doses already. And to make this possible, to reach these numbers, we have deployed as much as possible, as biggest as possible number of vaccination points or infrastructure points. And for we are using the 3 main platforms for vaccines delivery, which is vaccination points that has around 3,400 something, which is the mobile crews or mobile brigades, and there's around 1,300, and also the centers for mass vaccination, we have around 450 of those. So all of this infrastructure, it was rapidly deployed to my liking, and each and every medical employee that works there, they've passed a specific education and training on the usage of every specific type of the vaccine, on the follow-up for adverse events following immunization. And so the big gratitude here to the UNICEF office in Ukraine and WHO country office in Ukraine, so that they can help us to build the training system when just in a few months we were able to educate a few thousands of medical personnel, and we made sure that we are able to do the jabs, to do the vaccines. And this is the victory, because right now we have the resources and we have the capacity of the rapid re-education of people. For example, if Ukraine gets any kind of new type of vaccine, what we used before on the territory, we used 5 main vaccines in Ukraine. And so I do think that Ukraine has a specific situation actually, because we have the free choice of vaccine for people who just like to get vaccinated. We have 4.4 million doses of AstraZeneca vaccine, almost 12 million doses of Pfizer vaccine, 10 million doses we got on the stock of the Sinovac or Coronavac, and almost 5 million of Moderna vaccine. The only vaccine, which is the Janssen & Janssen or Johnson vaccine, which does not have contracted, but we see it from time to time, and some people, they're just using this kind of vaccine just because like from the humanitarian aid or a charity support or something else. But this vaccine, any kind of vaccine, is accessible to any Ukrainian if he chooses to do so. And so we are trying to work right now on the fact to provide for an adequate potential for the cold chain equipment or the cold chain itself on different levels, so that we can have more and more of those services closer and closer to every single Ukrainian. And so our ambitious goals for the end of this year is in fact that we are trying to reach for 48 million shots or jabs. And but we do understand that we will not be able to reach to do more than 30 million. Therefore, we have in the past few months, we have drastically grown the amount of vaccinations. And we do understand that right now, in every day, this is around 317,000 of vaccination that are being conducted in one day. Therefore, we were trying to reach the higher trends than possible, but there is a negative portion of that question. The slower, the better. We are growing the number of people that did not get the second dose, so they are just not getting back for the second dose. And so the second problem that I see here, that the demand for the vaccine grows in the red areas only when the oblasts are getting into this red area. And so the people are not ready to vaccinate just to protect their own health. They're only vaccinated to have the freedoms or preferences to the access to the public places. And I think that this is not the best motivation there is. And if you would have a look at the way how we can get the separation of all of that, then we do have a list of the leader regions, which is the Poltava, which is Kiev City, which is Dnipropetrovsk Oblast, the Sumy, Chernihiv Oblast, and some other oblasts that are really the key ones. And so they're showing the really high indicators on the coverage, but still Zakarpattia, Chernivtsi, Volyn, Ivano-Frankivsk, so that the west of Ukraine, it still shows that they're lacking behind there. They have lower numbers of vaccination. And so this is expected because we understand in those oblasts, there is a strong anti-vax movement there. And so we also understand that in those regions, there have been problems with the vaccination because of the number of the religious beliefs and all of that. And so our steps right now, they are in the fact that we can slowly reach out to people that didn't get their vaccines done, to use different information platforms or technical platforms or means so that every person would have an access to vaccine. and also to promote and to give them an evidence-based information on the safety, efficacy, and the need for the vaccination. I would just like to say thank you to you for making the time to listen to my presentation, and I'll be more than happy to answer any questions that you might have. And right now, thank you.
Dear Dr. Kuzin, Deputy Minister, thank you very much for such a comprehensive presentation. I will leave the floor for question. My only comment is, of course, that you also gave us the impression that actually you are fighting a larger war, because you are fighting the war against all the COVID across all Ukraine. And I think that's much more challenging, absolutely, because also you have these anti-vax movements in the West and so forth. And I think that's the most important message that we are having. And of course, I would like to leave the floor for more interesting question to Dr. Kuzin from the floor on this epidemiological presentation. Over to the floor. Thanks, Doctor. Apparently, no question at the moment. Of course, the presentation was really clear and there were a lot of interesting maps. So if there is no question and everyone confirms that, I still want to thank again Dr. Igor Kuzin, Deputy Minister of Health of Ukraine, for this presentation, which was extremely clear. There is one question in the chat, but I'm not sure I can read that. Maybe Sophia, could you please give a look to the chat if this is a question? Okay, this is just, you can also use chat for active communication. Okay, thanks a lot. So I want to thank again Dr. Kuzin, and please stay online. I know you are busy, so stay online as much as you can, because this will be maybe interesting, and I hope we can still have more occasion to meet. It's such a pleasure to discuss. I would like to proceed with the next presenter now, and I want to thank the next presenter also for the flexibility of having allowed to anticipate the presentation. I'm talking about Mr. Anton Korinevich, permanent representative of President of Ukraine in the Autonomous Republic of Crimea. Mr. Korinevich, are you online? You are going to present about the impact of COVID-19 on the rights of Ukrainian citizens in the temporarily occupied Crimea. Can you please confirm you hear us, Mr.
Yes, good afternoon. Good afternoon, Mr. Moderator. I hope you can hear me well.
We hear you well. Please go ahead with your presentation, and it's great to hear that you speak perfect English. So,
thank you very much. Oh, maybe not perfect, but a bit of English. First of all, I would like to thank His Excellency, Mr. Ambassador of the Order of Malta to Ukraine, and the representatives of the embassy for organizing this conference on such an important issue, and for all the efforts which the embassy and in particular His Excellency Mr. Ambassador pays to the issue of COVID-19 and its impact on the health of Ukrainian citizens. And of course, having today a conference, such a big and reputable and important conference on COVID-19, of course, it's also important to talk about the situation with virus on the temporarily occupied territories of Ukraine. Unfortunately, as you all know, since 2014, after the armed aggression of the Russian Federation against Ukraine started, we have two parts of the territory of Ukraine being temporarily occupied. The Crimean Peninsula, which is legally the Autonomous Republic of Crimea and the city of Sevastopol, and the separate parts, separate districts of the Donetsk and Luhansk regions. So, of course, the situation with COVID-19 is of grave concern for us, for state authorities of Ukraine, which work on these issues. And unfortunately, we need to say that the temporarily occupied Autonomous Republic of Crimea and the city of Sevastopol are currently experiencing a real humanitarian crisis, which continues to worsen as a result of the COVID-19 pandemics. According to the public sources and information received from citizens of Ukraine residing in temporarily occupied Crimea, the occupying power has failed to take the necessary steps to combat the spread of COVID-19 among the population of the occupied Crimean Peninsula. The number of daily cases of COVID-19 in the territory of the temporarily occupied Crimea has long exceeded the level that can be provided by existing medical facilities and available medical staff. As a result, many patients with severe coronavirus are denied hospitalization. The ambulance cars just do not come to the distant villages separated somewhere in, for instance, Crimean mountains. And this leads to a certain level of death. The greatest challenges the Crimean residents face include lack of hospital beds for COVID-19 patients, refusal to hospitalize even seriously ill patients, transfer of COVID-19 patients from hospitals to sanatoriums, where patients are left without needed medical supervision, no possibility to have voluntary COVID-19 testing, lack of access to ambulances and delays in the arrivals of the ambulances, absence of essential drugs for the treatment of COVID-19 in pharmacies, which makes home-based treatment impossible. In addition, the occupying authorities do not inform population about the risks related to the COVID-19 pandemics, as well as public and crowded places are not controlled for the use of individual measures that can prevent spread of COVID-19. Also, we are very concerned with the situation in penal institutions in the occupied Crimea, mainly in jails. Significant outbreaks of coronavirus infection occur in particular in prisons and pre-trial detention facilities, where a lot of Ukrainian citizens, unfortunately, are being held, in particular Crimean Tatars. These people, our citizens, are threatened by the poor quality of medical assistance provided in Crimean detention facilities, and in most cases, this applies to Crimean Tatars. According to estimates by human rights organizations, the trend of politically motivated persecution continues, and the number of Ukrainian citizens who are unlawfully imprisoned in the Russian Federation and occupied Crimea is being increased. During the COVID-19 pandemic period, the occupying courts have not changed their usual practice when determining or extending restraining measures. According to information from human rights organizations, over the past 9 months, the security forces of the occupying power conducted 46 illegal searches, 238 arrests, and 238 examinations. The COVID-19 pandemic has worsened the situation of persons held in pre-trial detention facilities. Human rights defenders know that neither the Federal Prison Service nor the administration of the colonies or prisons have made any effort to meet minimum health standards. Testing for COVID-19 in prisons is virtually non-existent, and therefore it is difficult to ascertain the number of cases of coronavirus among the Ukrainian prisoners in Crimea. However, according to the information from human rights defenders, there had been outbreaks of coronavirus in several colonies where Ukrainian prisoners were being held. Illegally convicted by the Russian Federation, Ukrainian citizen Hennady Lemeshko was vaccinated by the so-called vaccine Sputnik, which is unrecognized by the World Health Organization, against his will. And the employees of the prison colony of the Federal Penitentiary Service of Russia in Stavropolsky Krai, where Hennady is kept, forced him to sign the agreement for vaccination by threatening him with transfer to disciplinary cell and ban for visits of relatives. The health of Mr. Lemeshko has quickly deteriorated. He had tachycardia, health problems, and severe headache. The administration of the prison refused Mr. Lemeshko in provision of the medical aid, and it is a blatant violation of many of the international human rights conventions. Many Ukrainian prisoners suffer from chronic diseases, are particularly vulnerable to coronavirus. The Southern District Military Court of Rostov-na-Donu has ruled to extend the pretrial detention for Crimean Tatar prisoner Zakir Muratov for 3 months. The defense, arguing that Muratov's detention was unfounded, said that he had been suffering from coronavirus disease in times when his staying in the jail was extended, that he had serious risks of cardiovascular disease, that he was disabled and had a minor child. However, after a long break, the court ruled that Muratov would remain in jail until February 2022. The actual state of affairs reveals that in the course of the monitoring, it is highly concerning that in jails, particularly in jails in temporarily occupied Crimea, a quarantine cell has been designated, which, according to the inmates, is supposed to accommodate up to 6 people. Inmates displaying symptoms of COVID-19 or viral respiratory infections are placed in that cell, which lacks proper sanitary conditions and has no hot tap water. Inmates with COVID-19 symptoms only get their temperature taken instead of being tested. So no test at all, only temperature taken. Inmates at prisons have not been provided with personal protection equipment, such as masks and disinfectants. The Simferopol pretrial detention facility is overcrowded, which is also confirmed by the occupation authorities. This is a big threat because in Crimea, they have only 1 pretrial detention facility, and it is now really overcrowded, and a lot of prisoners unfortunately have COVID-19. In addition, the Russian Federation continues to transfer Ukrainian citizens from occupied Crimea to the territory of the Russian Federation. What is also important is that COVID, of course, had big impact on the case of movement from and to the temporarily occupied territory of Crimea. We need to mention that now, in November, we have approximately 1,500 or 1,600 of crossing the administrative boundary line between the temporarily occupied Crimea and the Kherson region of Ukraine. So the movement of people is constant. And since September, Crimean residents with Ukrainian passports can cross the administrative boundary line with Crimea and mainland Ukraine using COVID certificates, Ukrainian ones. That is, if they complete a full course of vaccination. At the same time, if they complete a full course of vaccination, they do not need to install the DIA application and go through isolation. At 2 checkpoints working now on administrative boundary line, Chongar and Kalanchak, after passing the border control, the citizen of Ukraine can take a test for coronavirus infection for free. So that is a free express testing. And if the result is negative, so a person can immediately cross the ABL and go to the governmentally controlled territory without the need to go for self-isolation. Vaccination certificates are also accepted at the administrative boundary line, but they must comply with the model of the World Health Organization. And the so-called Russian vaccine Sputnik is not registered. Therefore, the citizens which are vaccinated with Sputnik, they cannot cross the administrative boundary line without self-isolation. So Ukrainian state authorities, in particular Ukrainian state bodyguard officers who serve on administrative boundary line with Crimea, consider that the person is not vaccinated if a person is vaccinated with Sputnik. Moreover, there are cases in Crimea, and our citizens do tell Ukrainian authorities about that vaccination with the so-called Sputnik vaccine can cause serious problems with health, in particular cardiovascular diseases and diseases of heart and blood system. Unfortunately, we had several deaths of our citizens in Crimea, which might have occurred due to vaccination by the Russian so-called vaccine Sputnik. Moreover, the Ukrainian citizens who permanently reside in Crimea and who are working in the budget sector of the occupying power are forced to make vaccination with the so-called Sputnik vaccine. A lot of students are being threatened that if they do not get this vaccination with the so-called Sputnik vaccine, they will not be let to have their exams passed in the universities. A lot of people who work in budget spheres, they say that they are threatened that they will be fired if they don't get this vaccination with the so-called Sputnik vaccine. And a lot of medical personnel also say the same. A lot of medical personnel working in hospitals now in Crimea are not willing to have vaccination by this so-called Sputnik vaccine and try not to make this vaccination happen, to omit it, not to come in that very day to the workplace or whatsoever, not to have this injection of this vaccine. So all in all, to finalize, unfortunately, really, the situation in Crimea is a really humanitarian crisis. We really see that many things were really tested by the occupying authorities on our Ukrainian Crimean residents, in particular the so-called Sputnik, one of the first regions where the Russian Federation.
Sorry, I think there is a problem because Anton, you got muted. Sorry, Anton, we don't hear you anymore. Please try to catch on the last sentence, and also please.
Yeah, sorry. I hope. Yeah, thank you. And unfortunately, now this is not becoming better, and really we are trying to do all that we can in order to assist our citizens on governmentally controlled territory. I thank you once again for possibility to talk about this issue on this conference, and many thanks to the Embassy and His Excellency Ambassador for such an important issue, for bringing such an important issue to the attention. I thank you.
Thank you very much, Mr. Korinievich, for such a comprehensive speech. And it's maybe a bit challenging to summarize because you were giving a lot of let's say points, general points is categories. And in the case you were mentioning also, it was categories of people detained, and definitely this is something that is normally still not well focused even in the other part of the world. So I think it's not only a Crimea issue, but it's also an issue to be considered across all the rest of Ukraine and across all the world. So thanks a lot for bringing this ahead. And I would like to give the floor, before giving the floor to the next speaker, to anyone who has a question for this presentation, because of course it was very interesting, and maybe someone has a comment, questions, or something to discuss about the statements. So I will allocate 1 minute, and then if there is no any question, I will move to the next presenter. Thanks again to Anton Korinievich. I don't see any question, and please stay with us. I would like to give the floor to the next speaker, who of course is the health coordinator of one of the most important international actors in the world, is the International Committee of the Red Cross, in this case to Ukraine. Definitely, they take a lot in consideration of vulnerable categories, so it will be really interesting to hear what's their point. But the presentation is Mr. Graham Duggan. It will be more about the challenges to COVID-19 immunization in Eastern Ukraine. I think also this is a very interesting topic which was brought up by the Ministry of Health, by Israel, and in a certain point, but with different perspective by Mr. Korinievich. So Graham, are you with us? Can you please confirm you hear us and you can talk?
Yes, I can confirm if you could confirm that you see the presentation.
Yes, we see the presentation with your summary on the right. I don't know if you.
Okay, now I want to reverse screens. Just one moment, please.
For us, it's good, but
how's that?
Now it's perfect. Go ahead.
Okay, thank you very much, and thank you very much for all and the ambassador for the opportunity to speak at this important gathering. Having been here now 5.5 years in Ukraine, I have certainly gone through quite a few things, and certainly the COVID situation is certainly a significant part. As you know, ICRC, as you may all know, the ICRC works to assist those who are impacted by the current conflict in eastern Ukraine. And that's what our primary goal is. But we also had an opportunity earlier in the year to work with the Ministry of Health and UNICEF to help with the infrastructure support of the vaccination campaign in eastern Ukraine. So today, I will just want to go through a brief summary of that effort of ours. I will just work through quite quickly 1 through to 4, and maybe dwell a little bit more on 5 and 6 on the in terms of how and our current experience. As it's still ongoing, how it's been in terms of providing this infrastructure support for the vaccination campaign by the Ministry of Health. So as you know, these figures might be a little bit out. I noticed that they were likely slightly out from earlier presentations, but it gives the point that is demonstrated in the slide that in eastern Ukraine, in Donetsk and Luhansk, government-controlled side, is quite a low vaccination uptake compared to the rest of Ukraine. These figures, as I mentioned, may have changed. And this, there's a number of reasons for this, and I'll go through those in a minute. So what we did, we were approached, and we were in a good position to be able to support this vaccination campaign. So in early June, we did a rapid assessment on both sides of the conflict, on non-government side and government side. We then moved to order a number of infrastructure support following Ministry of Health's guidelines of the vaccination campaign in the country. We've moved through to a complex signing of MOUs, which took some time. And then while that was happening, we started planning the delivery and distribution of this quite complex operations, given that the location of where we are along the line of contact. Though we operate predominantly within 15, 20, 30 Ks of the line of contact, though we don't make a specification in terms of distance. In this case, we are supporting the whole of the oblast, both Luhansk and Donetsk, and we're supporting both government side and in Donetsk, non-government controlled side. But it is in a modified manner. So we're now moving through to beginning distribution, and we had hoped to finish by the end of the year, but given a number of reasons that you'll soon see, we're now expecting that this project will be completed by February next year. So what are we doing? Well, again, following very closely the Ministry of Health's recommendations in terms of the vaccination campaign, we identified medical equipment, cold chain equipment, non-medical equipment such as tables, chairs, etc. And very importantly is the IT equipment, because many of the PHCs and ambulatories have not got that compatibility or electronic linkage, which is very important to ensure that those who are vaccinated are uploaded into the national database. I will speak to a bit more detail on the cold chain in a moment. Okay, cold chain. We very much focused on our efforts on provision of active cold chain materials, and this is perhaps the largest of the complex part of it, given the size of the refrigerators, freezers, and of course the complexity around ensuring that these items are both installed correctly, and that the power supplies are focused correctly so it doesn't burn out the fridges, and of course the ensuring generators are available to cover the risk of power interruption. We also, of course, deal with the passive cold chain, being cold box ice packs. So this map is not, or the dots are not where we're going, because as I said, we're covering all the oblast in this campaign or in this project, but it gives you an indication where ICRC is focused in their other health activities. Just out of, in terms of the immunization support, we're going to be covering 87 facilities in Don GCA, 96 health facilities in Luhansk GCA, and we'll be supplying again in Donetsk, the non-government controlled site, but we'll be delivering it to the one health administration location. There's the actual figures in terms of the numbers. It's quite a lot more facilities than we support in our other programs, such as our chronic disease program and our support to diabetes type 2, our hospital program. This is quite an enlargement on our support, and of course a huge pressure on our logistics to be able to get these items out. So this is the actual figures. Of course, they pale in comparison, of course, to the national numbers, but in terms of the two oblasts, it's quite substantial. So we've already distributed over 1 million syringes, and the biggest part of this process is the freezers and the fridges. So 191 freezers of 28 liters and 152 freezers of 111 liters. And as you can imagine, these are quite large items, so it is going to and is currently having some significant logistics issues. So what we have noticed even from the outset is, and it's already been spoken about by the other speakers, is this huge vaccination reluctance that exists. So we certainly have our worries that the moment when we finally complete this project, that will open doors, and well, the health facilities will open doors, and we'll hear a tumbleweed go down the local road where no one actually comes in. And the reason for this is a survey. Well, the way it could be graphically displayed was our colleagues in URCS, who we work very closely with, undertook a survey of 1,390 people earlier this year, and I draw your attention to the 69% of respondents who said that they do not plan to get vaccinated, which is quite a stark figure and something that is quite a mountain to overcome. Fortunately, in cooperation and partnership with URCS, we have developed, or URCS has developed a program of sending out mobile health teams to help provide the information, education, communication that's required around vaccination to try and overcome this COVID-19 vaccine hesitancy. This has come about by the production of 192,000 copies of IEC material, and that's been donated to 192,000 people, and has had some, we hope, has had some significant impact, though we haven't had a follow-up survey on that yet. Okay, this is the key areas which I really want to speak about in terms of, I've got a minute to go. So is the logistic challenges, and that's both local logistics and importantly, as you all know, about the international logistics supply chain. So if this was graphically described to me, or well described to me by the logistician yesterday, when he said that our fridges could have been made in the fridges that we were ordered in one day, but they had to wait 6 extra weeks or 6 weeks for one single part that was preventing these fridges and freezers being created. So this is a real significant challenge that we're facing, and that's why the delays that we're getting through to next February. Also, we are looking at significant challenges at the health and facility level. We're talking about the lack of HR at these PHCs, the vaccination centres. A lot of the staff are elderly, are not able to move significant material. These facilities are old, they have old power systems. Even finding a place to put a large freezer in these facilities is a complex point. And also you need the support of the installation of not just a fridge. You also need to train around the use of generators and uninterrupted power supply mechanisms. So yeah, it's quite complex. We are underway. We have delivered and we will continue to keep delivering right through the middle of winter. And we do hope that all the components will be to get in the facilities by February next year, and these facilities will be able to open at full. Well, initially. We'll start the campaign and I hope you'll be able to ramp up to increase the amount of vaccination in these very complex areas around the line of contact, especially in these small communities. And yes, that's what we'll be doing. And we have a lot of issues around the documentation, around ensuring the linkages between overseas or where we've purchased freezers and quality control issues around ensuring that they meet the quality control mechanisms of Ukraine. So that's really some of the lessons we've currently learning and facing down in the east. I'm sure there will be more. So I think that's where I will end. And thank you very much for your attention today.
Thanks a lot, Graham, especially for these final two slides on the challenges, where you were showing some important results. Definitely the logistical challenges may be the most important for such a response actor. You were also showing some data from the Red Cross, the Ukraine Red Cross, which of course is part of the Red Cross family. There is a question from you, from Lee Rini. I don't know if they want to jump in or I can read it, but basically they are asking whether the 69% of this sample you were mentioning were regarding the whole Ukraine or just Donetsk and Luhansk. I think it's the whole Ukraine, right?
My understanding is it was a nationwide survey.
Yeah. So we have an hesitancy that is quite, I mean, the sample is what it is, of course, but
it's very small, yes.
It's a small sample, but there is a similar study that is being done by the WHO and also other by the medical group of UN, and they don't have bigger samples than that, but still it would be good if you want to connect with them and see if these results are matching, because this is absolutely an important information. So I want to thank Red Cross and Mr. Duggan, and I would like to ask the floor if there is other questions. Very good if you write them in the chat as was done by Lee Rini. And please, 1 minute for this question. Okay, I see that we can give the floor to the next speaker. It's another colleague that I know quite well from the Office of the Coordination of Humanitarian Affairs, which is of course coordinating all the humanitarian partners in the east of Ukraine. It's Mrs. Elisaveta Zhuk, Public Information Officer for UN OCHA Ukraine, and she will present the humanitarian impact and challenges of COVID-19 pandemic in the east of Ukraine. Elisaveta, are you online? Do you hear us?
Yes, I'm online. Can you see me? Can you hear me well?
We
Hope
do.
So. Perfect.
Yes.
Perfect. Thank you, Maniela, for the introduction. And I want to thank the Ambassador, Your Excellency, for giving the OCHA the opportunity to also give our take a little bit more broadly than on health effects, probably. So I'm just going to share my presentation as well. Hopefully you can see it now on the screen. If you also can confirm that, I'll just.
Elisaveta, as per the others, yes, please put the slideshow. Here you have it. Okay, now it's all clear. Please go ahead and good luck.
Thanks, Mariela. So I'm going to be talking more about the humanitarian impact of the COVID-19. So it was already extensively covered in terms of the health effects of the COVID-19, but I'm going to be talking a little bit more about the effects the humanitarian response and the humanitarian situation in Eastern Ukraine. So those are the aspects that I want to go through today really quickly, since we have very short time allotted for each presentation. So first I want to start with a brief overview of the humanitarian situation to give a little bit of a perspective, and then go a little bit more into detail about the impact of COVID-19 and conflict affected people beyond the health effects, because we already heard quite a bit expert knowledge on that front. Then further on, moving to the impact on the humanitarian response, and just to sum up in the last section. So just going forward, in terms of the humanitarian situation, those are all the numbers for 2021. We have estimated 3.4 million people in East Ukraine. They are this year in need of assistance. Below that you see the numbers, which is GCA, and GCA that's again stands for, that's what Aaron also used in his presentation. This is government controlled and not government controlled areas. Just a little bit easier to put it like that in the presentation for the sake of space. 1.9 million number is the number of people that we're targeting with assistance in 2021. You also can see the breakdown between the government and non-government controlled areas. And on the map a little bit more in detail in what oblast people are living in and what side of the contact line. Yes, so moving on, I just don't want to spend too much time on the numbers. I just wanted to cover the 4 key drivers we're currently considering that are driving the crisis. And I mean, of course, COVID-19 is one of them, starting from last year. So just to also quickly go through them, the first is the conflict in itself. I mean, of course, we all know about the ceasefire that was brokered in last July, which actually brought marked reductions in terms of hostilities and security incidents, and also brought down the number of civilian casualties, the trend that we're unfortunately seeing reversing at the moment. So for example, the numbers of security incidents that happened during September, October this year, they're 50% higher than it was last year, which is very concerning. Unfortunately, the same trend goes for the level of civilian casualties, because the level of civilian casualties reached the pre-ceasefire level this September. So that's also quite a concerning indicator. In terms of the political situation, of course, it remains extremely complicated. As we're all observing, we haven't seen much progress achieved in terms of the political negotiations at reaching a peaceful resolution to the conflict in Eastern Ukraine. So the existing forums, I'm talking about here, the Trilateral Contact Group and Normandy 4, unfortunately have not reached any significant results that kind of will give us an indication that the conflict will reach sort of a more, there is some progression on the peace negotiations. So with the COVID-19, obviously, all these aspects that are already written here have been already mentioned and covered very extensively, so I'm not going to go into that. But I think I will highlight as well the thing that was mentioned by Kornevich as well in terms of Crimea. So basically, that also one of the issues we're seeing in terms of COVID-19 is this lack of recognition of the vaccines that people are uptaking, including conflict-affected people in government-controlled areas and in non-government controlled areas. This was extremely well highlighted. Non-government controlled areas, this is the majority of Sputnik vaccines that are being taken in government-controlled areas, as we have seen from the presentation of the Deputy Health Minister. Those are the other vaccines, which are unfortunately result in the necessity for Ukrainians that reside in the areas beyond government control when they cross to Ukraine to undergo quarantine, because Sputnik, of course, is not recognized. But that's going forward is important from what I want to cover. So, and the last, which is a very, very huge and very important driver of the crisis for us, which is directly linked to the COVID-19, because the movement restrictions that we're observing right now are a result or like a safety measure to contain the spread of COVID-19. It's the partial closure of the contact line. As you know, like very shortly after the COVID-19 was came to the territory of Ukraine, the line of contact was mostly like sealed off, and it's remained like that until now, and there's no expectation that the situation will change. So also to give you a little bit of a perspective and a comparison how it was before and how it is right now. So for example, between January and September 2019, so for this 9 months, the average monthly crossing level was 1.2 million, which came down to this year to around 63,500 crossings per month on average, which is a 94% reduction. So what we're seeing, that's pretty much, I mean, we cannot say 95% people less, but at least we're observing a huge reduction in terms of like connectivity between government and non-government controlled areas, which has a lot of implications on conflict affected people, particularly those who are residing in areas beyond government control. So the next point that I have here on the presentation actually covers the specific points. It's of course, people who are residing in areas beyond government control, were not able to cross for almost 20 months or even more than 20 months now. They were not able to access social entitlements, which include the pensions. So we're talking about, as Israel also been mentioned in his presentation, it's one of our biggest caseloads. So the people, elderly people, are one of the biggest portions of people in need in our response breakdown. So lack of access to pensions, it also includes access to social benefits, as well as services, and goes for both government-controlled areas, non-government controlled areas. This is increasing social disconnection, like between the once united region, which is also a very problematic thing, especially in terms of future reconciliation, if this is something we're talking about. Then going on impact on conflict-affected people. I've made, I think these presentations will be shared on further with all the participants. So just not to, because I've made a breakdown for different categories of conflict affected people that we have in Eastern Ukraine, and going into more details on specific effects that COVID-19 has on them beyond, again, health impacts. But I will just briefly cover that because we don't have so much time. First, so the four main factors that I would like to outline, of course, there are more, but it's just the main factors that we consider are important. So first, this is the direct implication of COVID-19 in Ukraine is the quarantine movement restrictions, of course, which are going to come later to again, come back later to again. And so the quarantine and its implications. So for example, I put here two examples that might illustrate it really well. So for example, distance learning and remote working arrangements that were introduced as part of quarantine. So when we're talking about distance learning, according to UNICEF, I mean, we have UNICEF intervention later on, so I'm sure they will cover that as well. So around 614,000 children are affected overall by the quarantine restrictions. But when we're going forward and zooming in back to Eastern Ukraine, we have the estimations that at least 24% of families were affected, were not able to provide a good environment for their children to learn on distance. And if we're going even more into very rural communities, areas close to the contact line, this percentage raises to almost 50%, 47% of families who have challenges with distance learning of their children. If we're talking about the learning loss, so it's estimated to be around 20-30% according to education cluster, that the children, this is how much, like, you know, what, so 1/3 of the program, pretty much children are not, they're missing out on, considering that. So this is, the situation is quite severe, especially in the conflict affected areas where we're talking about really vulnerable people and families. Then just to not stop for too long, the partial closure of the contact line, as I've mentioned before, of course, it affects millions of people that reside in Eastern Ukraine, and particularly those that are residing in areas beyond government control. But the specific effect on the elderly that I would want to highlight, before the closure of the contact line in March 2020, 60% of all crossings, so it's like we're talking about is 1.2 million that we observed before, were made by the elderly to withdraw their pensions and sustain their internally displaced person status, so basically to continue receiving the pensions. According to very recent estimates of this year, so around 53% of the population living in areas beyond government control rely on pensions as their main source of income. And very staggeringly, very impressive number that we saw, that 94% of people that were surveyed responded that they were not able to access pensions in government-controlled areas in the 3 months preceding the assessment. So which like shows the very strong indication that a lot of people are very severely being affected. They're not being able to retrieve their hard-earned pensions in government-controlled areas. Of course, the areas particularly affected are the Dонецька області, beyond government control, because they have a little bit more tougher restrictions in terms of crossing the contact line. And because of that, we see a lot of new tendency that more and more people are starting to take a detour through the territory of the Russian Federation, because for taking the detour, they don't need to receive the so-called permission to cross the contact line. So that's also quite concerning, because this trip is not only much longer, which can take to up to 24 hours, it's even not comparable with the lines that we observed before at the crossing the contact line, but it's also much more expensive, which could also average the trip to average pension payment in of a pensioner, so around from $100 to $150 for like a round trip to withdraw pensions in government-controlled areas. And the crossing of the contact line was much cheaper, like up to $20 max people could spend on it. So yeah, the second point I also covered a bit, and of course the COVID-19 related economic fallout. I'm also not going to go much into detail. Yeah.
You have 1 minute and a half.
Okay, perfect. Okay, then I'm going
to summarize maybe.
Yeah, perfect. Thanks. Thanks for the indication. That's also very good. Then I'm just gonna say a few words really quickly, maybe not go into the summary as well. In terms of the impact on the humanitarian response, of course, we experienced different delays in terms of delivery of aid and implementation of projects, especially this has been happening during the first few months of the pandemic. We also, although we had already pre-existing access issues, the COVID-19 unfortunately was used as a pretext to impose certain restrictions on the operation of humanitarian actors on aid delivery, as well as to exercise greater control over the implementation of humanitarian projects, especially when we're talking about areas beyond government control. Also, the movement of humanitarian workers and humanitarian aid has been affected due to movement restrictions, so it has been unpredictable. There were a few positive things which you can quickly skim through. It just overall, although there were many challenges connected with the implementation of humanitarian activities, we did manage to actually reach more people in non-government controlled areas in 2021 in the first 9 months than in the whole year of 2020, which is a very positive sign. I mean, the challenges remain, the access remains unpredictable, but we are coping, which is a good sign. Since I know that I don't have time, just to, with the very wide strokes, to say that we are expecting the COVID-19 will continue influence and drive the humanitarian needs of people, exacerbating the existing vulnerabilities and affect the implementation of humanitarian projects in Eastern Ukraine and particularly in non-government controlled areas. We do also expect that the contact line will remain largely closed in 2022, which is going to be very concerning and continue to affect people in Eastern Ukraine, and particularly those again residing in non-government controlled areas. So I think that's it very generally. I'm very happy to answer questions, if any.
Thanks a lot, Elisabetta, for maintaining our schedule. And this was a very comprehensive presentation with a lot of data. We look forward to, of course, if you will share it, this will be important. Some parts you have skipped still for our record. In general, she has presented, of course, OSHA essential number, what are the people in needs. Also to be mentioned maybe that the new humanitarian need overview will be launched soon, let's say by end of this year, normally as by tradition. And we don't anticipate much, but of course the number of people in need has slightly diminished. It's about 2.9 if I remember well. And those information are always available in the website humanitarianresponse.info. So you can have always the latest number on the humanitarian situation. And this is the great job done exactly by OSHA in several countries, I think at least more than 20 across the world. So again, congratulations to Elisabetta for this presentation. Is there any other question for that? I see somebody is approaching the microphone. I don't see question for you, Elisabetta, but also because presentation was pretty, let's say, to the point in that regard. And there is a message in the chat from I translated it into English. It's quite a long message about the Swiss Institute for Cultural Diplomacy. So if there is no further question for Osha, for Elisabetta, I would like to give the floor to the next presenters, which is the UNICEF mission to Ukraine. These are two people that I work with them daily, particularly Dr. Igor Katisyadze, but also Dr. Murat Sahin, that is the UNICEF representative, of course. And so they will present about something that they are doing really with great competence, the cold chain system strengthening and the role of home visiting program in increasing prevention and vaccination coverage. I want to give the floor again to UNICEF, thanking them a lot. The floor is yours. Please let us know if you need any help for presentation.
Thank you very much, Emmanuel. Dr. Ihor will be making the presentation, but I would like to take the opportunity to thank the Ambassador Antonio Gazzanti, as well as all the international community for their solidarity to the COVAX platform, because through COVAX platform, UNICEF was able to bring in over 8 million doses of COVID-19 vaccines in Ukraine. I have 2 points before Ihor's presentation in addition to that. COVID not only affected the health system, but it's a huge crisis on children also. You see in Kiev, schools are closed thanks to the advocacy of the Ministry of Health, Ministry of Education, the WHO and UNICEF. We hear on 22nd schools will be open. So we believe children are also bearing the brunt of the COVID-19 crisis. They're losing their grandparents and intergenerational memory loss. They're losing school hours, learning outcomes. They're exposed to mental health challenges and lots of loss in income of the families, affecting mentally children and their socialization. And also, on top of that, childhood vaccination. I mean, Ukraine is well known with the anti-vaccine movement. Every 4 years, there is a measles outbreak. Currently, we are living with a polio situation that needs also mass mobilization of WHO, UNICEF, and Ministry of Health. So there is a lot at stake for children. But let's hear from Ihor on the technical work that UNICEF is doing related to cold chain system. Thank you, Emmanuel.
Thank you, Murat. And for this important point on children. And please, Igor, go ahead with your presentation.
Yes, thank you, dear Emmanuel. Can you hear me?
I can hear you well and sound. Please go ahead, sir. And
good afternoon. Good afternoon, Your Excellency. Good afternoon, distinguished guests. And thank you, dear Murat, for this privilege to speak on behalf of health and to present those UNICEF activities and those UNICEF programs which aim to protect children and to strengthen healthcare systems in conflict areas. I will not stop in details on this background and introduction because a lot of things were already said, and maybe just 2 critical points. That first of all is the child mortality. You see that in general in Donetsk and Luhansk oblasty, these figures are not critically high. But if we go down, if we go to district level, we can find that in some districts, mortality rates are crazy high. It's 4 or 5 times higher than in average in Ukraine. This information, this data should be developed more and observed more, because collecting data from national health services and the national statistical services, we can see maybe some general figures. And it's quite important to go to district level and even to facility level, to Hromada level, and see the problems there. Another point which was already said is influence of conflict and influence of COVID on access and quality of healthcare services. And here we have our UNICEF own data, and we see that around 50% of our responders, among 2,000 people, families from Donetsk and Luhansk Oblast, they noted that conflict and then COVID significantly worsened the situation with access and quality to healthcare services. Here I would show maybe very famous slide. Very famous thing is about health system strengthening. What is important for us to support or to strengthen, or maybe to transform our support into strengthening of existing systems? We see that we have a lot of challenges. It was conflict, COVID, now just we're waiting maybe for polio, and something else may happen every day. And of course, we're living in a very just dynamic environment, reforms, health and decentralizations. We have lack of human resources, medical human resources in the region, unclear financing mechanisms, maybe some misunderstandings in terms of roles and accountability among health managers and health workers. And of course, availability of trusted data and some specific demand from populations here. But for us, the main principle and the main purpose is to increase access, to increase daily routine access to quality healthcare services for the biggest part of the population, to reach those people who are out of healthcare services, just like to decrease the coverage gap, as you see from this slide. What we are doing there? I mean, in 2020, when COVID just started, we, as many other actors, started with a direct support to healthcare facilities, provided oxygen concentrators, different diagnostic and treatment devices, PPE sets, etc. But it was only a beginning. And just after 1 year of this pandemic and outbreak situation, we found that the most important here is to make all our interventions and all our contributions sustainable, and to improve system and response of the system to current needs of populations. Here I will speak about vaccine management, because vaccine management is one of our global and Ukrainian and national priorities here. We started with the cold chain equipment. We've done a huge analysis of all levels of cold system in Ukraine, from national level to facility and mobile teams level, and just assessed the demand, assessed understanding gaps and what we need to improve and how. And as a result, we invested into development and installation of cold rooms. It's oblast cold rooms. It's also cold rooms and cold equipment for storage of vaccines at sub-regional, sub-oblast level. We are waiting for this equipment very soon, and hoping that maybe beginning of 2022, 2 additional warehouses will be installed in Kramatorsk and Mariupol. Why the cities? Because these cities are quite far from the oblast level warehouse from Lugansk. It's more than 2, even 3 hours of traveling. In addition to that, in addition to high, specialized level, we also provide support to direct mobile team, to those providers who every day do this vaccination and go to families and work in mass vaccination centers. And with support of our partners, we also provided and already distributed some amount of containers and vaccine carriers, including Donetsk and Luhansk GCA, 57 primary healthcare facilities and 168 vaccination points will benefit with this support. And of course, what is important to say is that it's not only boxes, it's also a system of temperature monitoring and also all necessary accessories to all these devices to ensure safe and effective transportation and storage of vaccines. One of new things we want to do all over the country, particularly here in the East, is a new system of thermo monitoring and level of regional, sub-regional and primary healthcare facilities. This system of thermo monitoring will allow to integrate international system, and this will allow to see from day to day dynamic of temperature. Even one person, Minister of Health or someone responsible, another responsible person can open laptop and see what's happening in every single region, in every single warehouse. And it's in terms of quality assurance, it's one of important approaches we want to do. I want also to thank colleagues from the ICRC, because definitely in close cooperation and with their support, active cooling equipment will be distributed to, many healthcare facilities in the East. We're also working with our partners on this part, on this project, and hopefully next year some part of this equipment will be also delivered to the Eastern areas. But in general, we are planning to cover all needs of all other other regions in Ukraine, except this one. One thing which was already raised by Murat, that UNICEF proactively participated in, let's say, logistic in delivery of vaccines against COVID. And based on our calculations, around 8 million doses of vaccines were delivered with UNICEF support. And apparently in Donetsk and in Lugansk, GCA, it was around 1.2 million general vaccines which were delivered there. Around 10% of them, which also with the participation of UNICEF. What we want to do in addition to procurement and, let's say, delivery of items is, of course, capacity of staff. Staff should be competent, how to use all these devices, how to ensure that vaccines are in safe conditions, that the temperature regime is not higher or just lower than it should be, it must be. And that's why we are working on the development and capacity building activities of medical staff. We already engaged and conducted more than 5 online trainings with including of 800 workers from mobile teams. In addition to that, we also conducted offline trainings for health managers, for health workers who are working in public primary healthcare facilities and vaccination points. And we also continue to work on this area to develop online e-course, let's say e-course, and which will be let's say uploaded and online available for all of them on public health center resources or resources of NHS. Another point which is also very important and should be mentioned here. Yeah.
Excuse me to interrupt you. You have 1 minute. So
yes, I'm finishing. Yeah. Another point which is very important to say is how to bring services to home. We know that we didn't identify that during pandemic, even healthcare facilities are not the best place, are not safe place. And here, many families and many children do not visit healthcare facilities for routine services. Sometimes even medical workers just prevent these visits. That's why one of our activities, strategic interventions, is to strengthen home visiting program, to implement model of home visiting nurses who will be fully equipped and competent to provide health and social support to all families in safe settings. This project was piloted in Kramatorsk, Mariupol, and Marinka region, and now we are waiting for inclusion of Bakhmut district, Novgorodovka, and Slavyansk district. So almost all Donetsk Oblast will be here in upcoming days. And main quality aspects of this work will cover such areas of immunization, breastfeeding, developmental science, positive parenting, father's engagement, violence, depressions, and many others. So as you see from this slide, we just trying to target all pillars of this table. And I guess that only having such comprehensive approach to not only to provide some equipment, but to strengthen the system, to increase capacity of staff, to develop SOPs, to develop model, to develop coordination mechanism, we can reach some success here. Thank you so much.
Thank you a lot, dear Igor and dear Murat from UNICEF. This was a very comprehensive presentation. I think it's very important that you were bringing a bit more of analysis at district level, which is absolutely needed. Actually, as L cluster coordinator, I look forward to see this data to add them in the public health situation analysis. We have sent you a request for that. We can resend it, and thanks for this. But also, all the activity done for vaccine is really important, and especially for the cold chain, I think it's great to do what you're showing. Although I think the message from Murat also was very important, and not only for health sector, but also the education sector. Absolutely, they are absolutely impacted by COVID-19. So I would like to give the floor for any question for the UNICEF colleagues. It's a pleasure to have them here, and I give the usual minute where we wait if there are questions. I don't see them anything in the chat. colleagues, please raise your hand if you feel like. Okay. I think there is no question at the moment for the colleagues from UNICEF, although I invite everyone to write on the chat. I take this time for still thanking the Murat Sahin and Dr. Igor Katsiadze from UNICEF, and I would like to give the floor to the next presenter, is Dr. Rainer Loeb. I hope I pronounced this name correctly, and apologies if not. He's the federal doctor of the Malteser, Germany, and he will talk to us about the vaccination program, the spreading of virus variants, and the burden of healthcare system in Germany. He will give us an overview about this. Rainer, can you hear us?
Absolutely, Emanuele.
Okay, please go ahead, and I see that you already have shared your presentation.
Thank you very much. And Your Excellency, Ambassador Gazanti Pugliese, and Moderator Dr. Bruni, and all participants, I'm very happy to be able to be part of this really important and helpful conference, learning from our experiences, helping to face this continuing COVID challenge. And there have been many important and interesting reports. Again, thank you very much, and especially to everyone caring in or for the people in Ukraine. All the best for you all. It was very, very impressive to hear and to see your presentations. What I can do, my contribution today can just be to open a small window into the situation in Germany at the moment. We really coped rather well with COVID until this summer. And at the moment, we experience a rapid increase in hospitalization rates of patients and in the occupancy of the intensive care units. And this is what really is a problem in our healthcare system at the moment. And for us and for everyone is the question, what really is the problem? Why do we have this increase in hospitalization, even if we did so well over a lot of months? And we just thinking that the vaccination challenge is really a problem. And just to underline it, I made this slide where I just compare the vaccination quota in the countries or several countries in Europe. And I'll show you later on how the incidences are going up in the countries showing on this slide, and maybe vaccination challenge and vaccination quota is really a key to get it under control. If you see Germany, not so bad, you might think. It's 67.6, the vaccination quota overall adults from 18 onward, and France 68.9, Italy 73. Well, not this big difference, you might think, but just looking at the right side, you have the 7-day incidence in the countries, and you can see that up to Germany or down to Germany on the slide, 319, it's more today. We are over 330 today. It was yesterday, these numbers. There is a really a gap to France. France with 117, and then Italy 90, and lower down. Where's maybe the key? And if you draw a line between Germany and France, then you're asking exactly this, because the vaccination quota is nearly the same. Between France and Italy, okay, there's 70% of vaccination quota of all people living there, and between Italy and Spain, there's nearly the 80% quota. So we'll see if this has an impact. If you compare Germany and France, an experience that I also personally made this year, what is the difference between France and Germany? Vaccination quota nearly the same, but Normally, Germany is known as a very well organized and structurized and consequent country, but we are playing with the fire at the moment. And I'm really thinking that one main reason why the gap is so high between France and Germany, we're not consequent at all at the moment. If you go to France, if you go to Italy at the moment, you have to show the pass sanitaire in France. You have to show the green pass in Italy, the Certificazione Verde, and it's controlled. It's controlled everywhere with the app checking if your certificate might be valid. In Germany, coming back from a few weeks in France this summer, in Germany, we experienced that at the restaurants, they just ask, "Oh, you are vaccinated, aren't you?" "Yes." "Okay, come in." Nobody really is controlling at the moment. And this is, of course, a problem. Just going further, Germany and the neighbors, and just in this graph, you can see the 7 days incidence and the vaccination quota. And if you look at this line in the graph, I think it's really evident that vaccination quota is a key to solve the problem of spreading of the virus. 70% might be a very, very good quota, but 80% is perfect. That's absolutely seeable. Yeah, you just can view it on the slide. And of course, if you're talking about variants of concern, at the moment we all deal with the Delta variant. We started in this year, we started with the Alpha variant, and now it's Delta over and over. And what we all experienced is that Delta is much, much more dangerous than the Alpha variant because it's spreading much faster and much easier. And if you look at the healthcare system burden in Germany, just now in November and going the weeks back, you can see the infection rate is going up and up and up at the moment. Hospitalization isn't as high at the moment as we had it at the end last year and the beginning of 2021. But it's rising and rising, and we have just another problem in the hospitals with the ICU beds. I can tell you with this slide, the green line is the free ICU capacity in 2020 and 2021 over the month. And the red line is the COVID patient rate on the ICU. And what you evidently can see easily on this slide, the free ICU capacity now is much lower than it has been end of the last year and beginning of this year. And of course, we have lower capacity. Why? Main reasons are, first, the care for emergency patients who are non-COVID patients, and also patients needing scheduled surgery and interventions and even diagnostics. They avoided to undergo over a lot of months. Now we have to care for all these people, even for the scheduled patients, but especially for the emergency patients. And our ICUs are full of emergency patients that what we didn't have last year in this quota, first thing. And the second, we have to talk about it, on the other hand, the absolute exhaustion of the ICU staff. They are absolutely exhausted. They didn't have the chance to recreate in over 17 months now. And this is the other reason, which are we experiencing now in Germany. Limited capacity due to a lack of staff. And if you look at the quota of the COVID-19 patients in ICU beds in Germany, at the moment, you can see that in the southern part and in the southeastern part, we are about 30% of the ICU beds are covered with COVID patients. and the quota of free ICU beds is going down and down and down. At the moment, it's about 8, 9, 10% in most of the region in Germany, and we are really concerned what will be happen in the next weeks because we know that we have sky-high incidences at the moment, and it's going up and going up and going up. And this is really a problem. And if you now compare it to the map of Germany with the vaccination rates, then you can see clearly that all the regions where the quota of the COVID patients in the ICU beds is really high, in all those regions we have lower vaccination. We just can't tell vaccination is a key. Who's or to win? And my personal point of view, but based on data from East and also the German view is, of course, the predominant Delta VOC is even more infectious as the other were. Immunization is the key, and vaccination is the best way to get immunized, not getting the disease, but just getting the vaccination, even against all these VOCs we know at the moment. Age 60 plus, it has been told earlier, is a great risk of getting a severe disease and has lower immunity after 6 months plus following the full vaccination. That's what we also know at the moment. And our theory is that we need an immunization quota of 85 plus in the population over 60 and in the population, and a quota of nearby 100% in all over 60. And then we will be on a good way. And booster vaccinations are getting more and more important, especially at risk groups. Today, the Council of Vaccination in Germany told that they recommend the booster now for everyone 18 plus. We started with the elderly, and I think it's better to immunize the elderly first. Of course, there's some hope for now and in the near future. Medication, monoclonal antibodies, okay, have to be given in the very, very early stage, which is a real problem. And of course, new antiviral drugs, there's some hope besides the vaccination, but vaccination is the best way because it's cheaper and it's easier and it's safe for every population. It has been the UNICEF team told us about the side effects concerning children. We are also experiences problems in children, very dangerous. Another season's infection. Normally, no problem, no big problem for us, a human orthopneumovirus, or in Germany, human respiratory syncytial virus. Normally, infants up to 3 years are getting this disease. We experience that infants up to 6 years, 7 years are getting severe diseases of this virus. The children's hospitals in Germany are completely overloaded. Nearly 80% have no free beds. And the pediatricians are telling us at the moment, the elderly dying from corona and the young now from RSV. And the reason is they had no immune training. In 2020, we all had distances, we had masks, etc., which is very, very important to cope spreading the disease of corona, but it may be a problem for our immune system. So we, of course, have to find a balance. And to refine the balance, vaccination is also the key, because then we can reduce other measurements. And the other side effect mentioned by the UNICEF, physical and mental health of children and adolescents, of course, looking down children's daycare centers and schools resulted in really noticeable worsening of children's health, and physically and mentally, even in Germany. And our children psychiatrists are telling us never close daycare centers and schools again. We will have a big wave of mental problems in the next years, and this will affect also the whole population. And the reason they had no social contacts, near severe deprivation, family incomes loss, fear, uncertainty, what will happen. It's really a problem which we shouldn't forget looking at COVID and vaccination and the elderly. This was a short view into Germany and the situation. Thank you very much for giving me the opportunity to talk here. Stay healthy, take care. And I think if we are working together in all the countries and if we are sharing our experiences, this is what we should do, then of course we can learn from each other, and so we will get around and we will get closer together, which is always important. Thank you very much.
Thank you very much, Dr. Lob. And this presentation was quite comprehensive for several points of view. I think was medical, but in a way was also philosophical, not philosophical, but let's say there was a component of data analysis. You showed how to overlap two maps. Even talking about Germany, you were talking about also other countries, and I hope this could be used for Ukraine, overlapping the vaccine hesitancy with the ICU difficulties. That's absolutely the most, let's say, get-go message. But there is also a comment about Italy. Maybe you were giving and the other countries, this is interesting, but I see there is a question from Dr. Giambattista Parigi. Yes. Doctor, please go ahead. If you could unmute yourself, Doctor.
I am muted, yes. My best compliments to Dr. Loeb, and I fully share his observation about the respiratory syncytial virus working in a children's hospital. Our hospital is completely full and packed by this kind of children. I have a curiosity about what is the situation in Germany, because here in Italy, we are in a good state as a number of vaccination, but we are still in a better state as aggressiveness of the no-vax people. How is the situation in Germany, and how you cope with this kind of people? Because waiting for the virus to kill all of them, it's a little bit too much.
It is, absolutely.
Too long a time. But actually, we are facing quite a problem from this point of view.
Yeah, it's the same in Germany, of course. And we are thinking that about 10% of our population we will never convince to get vaccinated. And congratulations to all the countries who made it not mandatory but obligatory to get vaccinated in the healthcare system and anything else. Our politicians at the moment have the impression that if they make vaccination obligatory for everyone in healthcare system, we will lose a lot of people. I do not think so. And I think the Italian and France experiences are showing that this is not the big problem. But these 10% in the population, I think we'll never get them. We just try to talk, and if you think about making vaccination obligatory for everybody in the country, I think then we might have another problem, just a really big problem in the population and aggressiveness more than today. And so I really haven't a solution to cope with these 10%. Sorry.
Thanks a lot. And thanks for this question, because it was also a question I was holding inside. I would like to give the floor to Aaron Aregai from WHO Ukraine. I see that he raised his hands. Aaron.
Yes, thank you very much, Dr. Love, for that excellent presentation. I saw in your last slide, you make a mention of 30% of your ICU admissions are vaccinated. Mm-hmm. Do you have a kind of more granular data towards those 30%? Are they elderly with comorbidities or any characteristics? That would be very interesting. And the second, maybe a follow-up to that is about the decision to have the booster dose for all above 18. I know many countries are advocating more for the elderlies or above 60s. It seems Germany is like more expanding this window towards more adult population. is it anything supported by waning of immunity as well from vaccination? Because there are a few studies that the protection from vaccination has much faster waning as compared to expected, in some cases up to 6 months significant waning level. So just want to reflect on those. Thank you very much.
Okay, very good question. Of course, the 13% of vaccinate people, of course, you're absolutely right. These are patients with a lot of comorbidities or mostly immunodepressions. One reason is, for example, organ transplantations and immunodepressant drugs. And one special kind of patients at the moment is patients with dialysis. And they also developed nearly no antibodies after vaccination. And these are the 30% immunocompromised. And what our vaccination council did today to open booster vaccination up from 18, at the moment, I really have no scientific reason, just the epidemiological reason, because they are thinking at the moment we might stop what we have at the moment, increasing cases, if we give a booster to a lot of people, because they might not be as infectious and not be transmitting the virus. But yeah, I think it's just the try to get it under control at the moment.
Thanks a lot for these two questions and for the two answers from Dr. Loeb. And I would like to give the floor to the next speaker, saying good luck also to Germany for next week, because as an Italian, and we've been through that some months ago, and this is definitely our lesson learned. I hope it's going to be better, but let's see. I would like to give the floor to Professor Fausto Baldanti, who is the representative of the Order of Malta Doctor to Doctor project, and is also the head of the virology laboratory of San Matteo Hospital in Pavia. He will present problems on virus variants and further development of this pandemic situation. I think this is the perfect way to conclude this meeting with a lot of forecast. Professor Fausto Baldanti, are you listening to us? Can you hear us?
Yes, thank you. Thank you for the invitation. And I try to share my slides. Can you see them?
Yes, we can see them.
Okay.
Please go ahead.
Well, as everybody knows, the COVID-19 is called in that way for one single day. So China was releasing the alert at the very end of 19, so the 31 of December of 2019, with the 27 recorded cases, among them only 7 in severe conditions. And of course, a few days later, ECDC was actually warning everybody in Europe about the possibility of this disease coming into Europe. And at that time, the situation was to check everybody coming or traveling from China to Europe, or having had any contact in this direction. This is one date that in Italy will be really remembered. At the 20th of February 2020, at 8 o'clock in the afternoon, in my lab, we received a sample of the first recorded cases in Lombardy and the first recorded autochthonous cases in Italy. And the next day, we were all aware of a big, huge outbreak in the Lodi area. This is Lombardy. Lombardy is a region in northern Italy with 10 million inhabitants. It's the largest region in Italy. Overall, Italy has 60 million people, so 10 millions of them are in Lombardy. In this Lodi area, there are 50,000 inhabitants. And these were the very first 10 municipalities involved in the first initial lockdown. At the end of the first wave, almost 1/4, 23% of individuals had contact with this virus, either symptomatic or non-symptomatic, meaning 1/4 of the patient, of the individuals there and here were infected. The infection started mid-January, 15 days later from the released alert. It is a short period of time to have this large outbreak. Okay, making almost 10,000 individuals positive. There were two major outbreaks, one in Lodi and the other one in Bergamo. And everybody is remembering the Bergamo picture of the coffins taken out by the army trucks. And this is the shape of the first wave. So February, peak in mid-March, and the fading out due to the lockdown that was implemented by basically the second half of April. Okay, analyzing the genetics of all the virus present in Lombardy in the first wave, well, we could confirm actually that many viruses were present, many variants were present in the very first wave, meaning the virus was seeded in Lombardy several times, at least 7 different times. A is the Chinese variant, and all the B that you see here are lineages that were derived and different from the A original Chinese variant. So 7 different viruses hitting a single place in the same time, actually also confirming the introduction of the virus in Lombardy by mid-January, because you can do by genetic clock. What was really striking in this analysis was the different distribution of variants in the Lodi outbreak here and in the Bergamo outbreak here. So since the very beginning, we could see that the presence of a different variant in a different outbreak can have a different clinical impact. And the variants that we are dealing with today is the Delta variant, as we already remember, that is more aggressive and more contagious than the Alpha one. But after all this first wave, what is left as immunity? And checking the 4,600 healthcare workers in our hospitals, we could detect how many people were infected in the first wave. And as many as 11%, 10% of all healthcare workers were infected. In addition, we were also checking the T-cell response, not only antibodies, but also T-cell response. All virus infection are controlled by 2 different mechanisms, antibodies and T-cell response. T-cell response are killer cells that kills basically the infected cells that are the factory of the virus. And what is clear is that the individuals infected by the virus can really raise up a strong response in T-cell response. But it also came out another information. An aliquot of non-exposed individuals retain a response to COVID because they had in the past an infection by a close member of the family, some other viruses that are present in humans and are responsible for common colds. So that is why only 1/4 of individuals during the first wave and not all the 100% maybe. Okay, the first lockdown faded out, everybody was happy, and everybody started traveling again and bringing back a lot of variants during the summer in 2020. And these were sort of the fire under the ashes. And in the autumn of November last year, that there was the second wave. This one was the first wave that was restricted only in Lombardy, was the picture that you already saw. And this second wave was involving the entire Italy. And so it's much higher, it's 10 times higher. So this was the real problem. Second wave, and then lockdown here again, and then releasing the lockdown, and then again lockdown, third wave in March, fading out during the summer. Well, are these immunity, are these contacts with the virus providing a sort of a protective barrier, immunological barrier? Again, we checked in the healthcare workers of our hospital and other hospitals, 3 different hospitals in 3 different places in northern Italy, making about 10,000 individuals tested. And to make a long story short, basically, a previously contracted infection provides a protection of 70%. That is similar, 75%, similar to what is the resulting protection from the AstraZeneca vaccination, and lower, little lower than the mRNA vaccines. Okay, but then the campaign started and everybody was vaccinated. And then we checked again the protection in the healthcare workers. And you can see here that here, the vaccinated individuals, only less than 1% could get reinfected by the virus. And this was the aliquot of those not yet vaccinated that could be infected. So the protection is really high. But what is really interesting is that those who had previously a natural infection and then got vaccinated, so they experienced a triple exposure to the antigenic stimuli, they were even more protected. So the infection rate in these individuals was half, so less than 0.5%. How can this be translated in the protection? Again, checking the response to variants. This was the original, here is the original virus, then the European virus, then the alpha, beta, gamma, and finally delta. You can see that vaccinated individual, you can have here naive and experienced, meaning naive, those that received 2 doses of vaccine, experienced those who received 2 doses of vaccine on top of a natural infection. You see the level of protection against the beta and the delta variants are strikingly higher than those receiving only 2 doses of vaccine. So a multiple exposure to the immune stimuli is indeed increasing the level of protection. Is this protection lasting or not? That's a question. Okay, these are data from a 6-month period and still unpublished, so please don't circulate. But anyhow, you see that you have a reducing level of neutralizing activity against the variants, but those who got vaccinated on top of a natural infection, they retain higher level of response still 6 months later. Well, then, are our individuals more protected than others? Maybe. This was one paper from US colleagues. They were saying that healthcare workers during the upsurge of the Delta variant got infected at higher rate and was in some way in the same direction of the increasing number of Delta cases recorded. Actually, we did repeat the same observation and we could not confirm that. The paper is just being accepted in New England Journal of Medicine. And you see that the number of people reinfected following vaccination was decreasing, not increasing, also in presence of higher number of recorded cases of Delta in the territory we are living in. So actually, vaccination has already been pointed out is not the single factor, but also reducing the distancing, mask, and all these procedures can increase the chance of infection also in vaccinated individuals. And this was the real difference between California and Italy in these two different studies. What is the situation in Italy now? This is updated today. So we have basically 84% of the population over 12 that is being vaccinated with 2 doses. These are data from our Ministry of Health, and these are from Lombardy. The darker color is the 3rd dose applied to over 80 and decreasing now, and the age. Of course, healthcare workers have been all them vaccinated for the 3rd dose. So in Lombardy, the rate of vaccination is even higher. We crossed the 90% double dose vaccination. So what the situation? The situation is this one. Last year, 2nd wave in Lombardy, these are Lombardy data. Last year, 2nd wave, the peak was 15 November, 8,000 cases, median 7-day cases, 8,500 cases. Here you have the data today. Today or yesterday, only less than 2,000, and the media is 1,000 cases per day here. So the difference from the same period of the last year is, I think, very striking. I can stop here and just to acknowledge the work of many people in my lab, and in the picture are all our students that were working in our unit since the very first day, and I thank you for your attention.
Thanks a lot, Professor Baldanti. It's very difficult for me to condense your presentation in a couple of sentences because there is a lot of technicalities. And I would just, I mean, the final message was the most important. Vaccination is really a difference. It's overlapping a bit to the message also for my presentation. As a humanitarian worker, I would like to recognize that also the last numbers, they go from 80% to 90, 95% are maybe the most important, because you can see each 1% more, you can see really a huge difference in big numbers. So this is the real important message you are giving to us, but obviously you also gave us an important study of each variant. Allow me to joke that some people said in WHO that the Greek alphabet is not enough, does not have enough letters. Maybe we could borrow from Aaron the Ethiopian alphabet that has 273 characters, and maybe this could help us, but this is a joke just to break the ice, of course. And we could open the floor to some questions to this very important presentation. Over.
I have Fausto just outside my door, but I can give him via Zoom the question that everyone wants to ask. When will be out from the pandemic? Well, because just only not going to the Ethiopic Amharic alphabet, also the Greek alphabet has 26 letters. We are around the epsilon, eta, gamma. Before reaching omega is still far, far away. Therefore, well, what do you think?
Well, there are some caveats that are important, okay? Has been already told. Every 1% vaccination, maybe third dose, or having a record of previous infection is helping really much in controlling the infection. And the other caveat is the many vaccinated individuals we have, the lower the number of variants are circulating, because we started, I told you, with a lot of variants, and now we have a single one, because the barrier, the immunological barrier is kind of cornering the evolution of the virus. Okay, so we are now really in a turning point. Either we win or we fail. Well, in my opinion, I'm optimistic. Saying that maybe we're close to win.
Many thanks for this optimistic words. Is there any other question for Professor Baldanti? Maybe you were also mentioning how long is going to be the protection, and this is an open question, of course, on my side, but it would be good if to understand, because the initial studies were based on some hypotheses, so maybe you might share some kind of hypothesis. Of course, there is no evidence for that, but you definitely are the person to ask also this type of question.
Well, what is important is not the level of antibodies. The antibodies is reducing over time, the level is reducing over time. What is important is the memory they can live out, okay? And the data that is not only our data, many researchers actually confirm the data that we can retain overlapping response to parent viruses, means that we might have a much stronger memory that we are thinking today. Of course, we will see in the future.
If I can add,
yes, please.
Just as a matter, I saw just yesterday this graphic showing how the protection goes down after full vaccination. And Janssen is the Johnson & Johnson single dose vaccine, while this is Moderna and this is Pfizer. They are going down. Is with this in mind that we are fostering a lot the idea of the third dose going on. I ran to get my third dose as soon as possible.
Can I comment on those graphs?
Absolutely, please.
That protection levels depends highly on the total amount of vaccinated individuals. In a context where the global amount of vaccinated individuals is high, that graph is different, is really different. So it is not only a matter of declining the antibodies, because if you have a single or 10 or 1,000 vaccinated individuals in a sea of an unvaccinated, well, the chance of getting infected is much higher than the opposite situation. And also you have a comment on the 3% of the ICU patient being vaccinated. It is true. We also see the same, but please remember the denominator. In Lombardy, we have 1,000 individuals positive every week, and half of them are among, so 500, in 8.5 million vaccinated. The other half, the other 500 in 1 million vaccinated. You can do a simple math.
Thanks a lot for this remark, and definitely always look at the denominator when we look at the data. I would like to move now to the discussion panel. I mean, we started already a discussion panel, but and this is extremely interesting, but just to bring back also the attention to Ukraine, and particularly to east of Ukraine, I would like to know if there is some kind of points of discussion. We definitely, I can summarize a bit in the sense that we definitely brought up the humanitarian condition of the east of Ukraine on the one side. I see that there is a couple of different points of view, because the words from the Ministry of Health was also a bit different in terms of, for instance, vaccine hesitancy. Although the numbers are low in the east, he was saying that the strongest no-vax movement are actually related to other zones of Ukraine, like, for instance, Lviv and the west part in general. So this could be one point of discussion that maybe we might think in a way, because in the last years we are looking at these humanitarian zones in a way that should be slowly graduate towards being included back to the system. So this could be one point maybe that could be taken in consideration. But I wonder if there is any question from the partners here online. It will be also good to hear from the Red Cross, because in a way, the intervention from Graham, from ICRC, was also including all the regions. So maybe this could be a point that could trigger if he's still online.
Yes, I'm online. Can you just repeat that question, please?
Yeah, I wondered, basically, we are trying to have a couple of minutes for discussion panel, and before we close the conference. And my question was more general. We look at Ukraine and we look at the east of Ukraine as two different entities. But in the latest years, we are trying to graduate this east of Ukraine, at least where is possible, of course, towards the entire system. And in terms of health system, this should be the next step of the graduation of health cluster, for instance, of the Nexus approach, which is the humanitarian development and so forth. So I wondered if, on the light of the data that you were showing, this could be something that could be taken in consideration, or at least in terms of the COVID hesitancy for vaccination, because the Ministry of Health was clearly demonstrating that actually there are a huge problem also in the West, but of course the humanitarian condition is another one. And then there was the representative of Crimea that was pointing instead a different, almost political component. Over to you for some consideration.
Yeah, I mean, we're very welcome to welcome any input from others as to what we're doing in the East. Yes, it's very difficult to, obviously we see COVID as being a very much a significant national issue. And the fact that we're in Ukraine, in Eastern Ukraine, of course, there is no demarcation on this disease. It is spreading and it continues to do so. And I think working together would be a very much a core component in to reduce the impact of COVID, especially on the beneficiaries, which are the elderly beneficiaries, which are along the line of contact. And we cannot do it by ourselves. We can't do it, even with the Ministry of Health are struggling. So we very much welcome that cluster mechanism to be able to ensure that we are doing it in complementing each other rather than doing in multiple different ways. So I very much point out that UNICEF has been a really strong partner in this, and ensuring that we don't double up, we don't go into place that and waste resources. So I think the compliments should go to them and in their organization, and of course their partners in the Ministry of Health. So I think we will still be part of we are observers of the cluster, and we certainly welcome that continuation and certainly look to support where we can. Thanks.
Thanks a lot. This was a very comprehensive consideration. I will see if there is any other partner or stakeholder that want to intervene. And if not, in a minute, I would like to give the floor to His Excellency's ambassador for the final word, thanking him and all the embassy for having organized this very interesting conference, really important also, especially the final part for me was really full of details that I really enjoyed. So if there is no question, I would like to give the floor to Ambassador, but let me check please 1 minute more just for. No more question. Dear Ambassador, please, the floor is yours.
Thank you. I would like to thank again the speakers and first of all, the moderator. You have played two different roles. First, moderator, and second, big friend of the order. Thank you very much. Thank you. I think that the speaker have given a very interesting, intensive, a complete framework of the situation in Ukraine, and especially in the eastern part of Ukraine. I hope that this was a constructive occasion to have a fruitful exchange of information and experiences from different points of view. I thank GDIP, my colleagues ambassadors, the representatives of international organizations, the doctors and the representatives of the important medical facilities from different parts of the world, the representatives of the Order and of the Malteser, and all the friends who participated in this event. I think that we will organize another conference next year, 2022, about this issue, because first of all, it is important to monitor the evolution of the situation. And secondly, it is important to maintain a high level of international attention on these issues, with reference, especially with reference to the east of Ukraine. Thank you very much, and see you soon.
Thanks a lot, and have a nice continuation of the day to everyone.
Thank you very much. Bye-bye.
Thank you.
Thanks,
all
everyone.
the best. Adieu.